हेलो गुड मॉर्निंग, मैं सिर्फ डॉक्टर आर्यन और आज हम डिस्कस करेंगे मेडिसिन के कार्डियोलॉजी सेक्शन के सम इम्पॉर्टेंट एमसीक्यू। A 64-year-old male with a history of hypertension present to the clinic with worsening renal function. On examination, his BP was measured 160 by 105. Upon further investigation, it is discovered that the patient has bilateral renal artery stenosis. Which of the following medications should not be given in the patient for hypertension? Losartan is not given. Angiotensin converting enzyme inhibitor and angiotensin 2 receptor blocker (CRB) are contraindicated in patients with bilateral RAS renal artery stenosis due to their potential and exacerbate renal dysfunction and cause acute kidney injury. Causes acute kidney injury and renal dysfunction. Next question. A 55-year-old male patient with a history of hypertension present with persistently elevated blood pressure reading despite being on different types of antihypertensive medication. His blood pressure measurements were consistently high during clinic visit and his medication adherence was confirmed. Laboratory investigations reveal no abnormality. Hypertension in this patient are commonly caused by all except. Here the answer is the excessive exercise that recommend. Resistant hypertension is defined blood pressure that remains above goal despite the concurrent use of three antihypertensive agents from different classes, one of which should ideally be a diuretic. Causes of resistance hypertension. Causes of resistant hypertension. Improper BP measurement should be ruled out. Alcohol intake, excess salt intake, obesity, non-compliance, of patient on COX inhibitor, cocaine and steroid. Next question. A 35-year-old female present to the clinic complaining of occasional headache and dizziness. Upon further examination, you notice unequal blood pressure reading in her left and right arm. Which of the following condition is least likely responsible for this finding? Unequal blood pressure reading in the left and right arms are commonly associated with condition affecting the aorta and or its branches. The right arm is aortic stenosis. Takasuyu arthritis, coarctation of the aorta and supravalvular aortic stenosis are all the known cause of this phenomenon due to the arterial narrowing or inflammation. Arterial narrowing or inflammation. However, aortic stenosis primarily affect outflow tract of the heart and is least likely to result in unequal blood pressure reading in the arm. Next question. Which of the following condition is not typically associated with the Mendelian cause of hypertension? Not associated with the syndrome X. Syndrome X, also known as the metabolic syndrome, or insulin resistance syndrome is not typically associated with the Mendelian inheritance pattern. Rather, it is a complex multifactorial condition involving genetic, lifestyle, and environmental factors included in the secondary cause of hypertension. Secondary cause of hypertension: renal parenchymal disorder and the renovascular hypertension. Here the chronic kidney disease, here fibromuscular dysplasia in young age, chronic glomerulonephritis, atherosclerosis here in old age. Next question. A 45-year-old male present to the clinic with a history of hypertension. He reported experiencing occasional dizziness and headaches. His current medication include amlodipine 5 mg once daily. You decide to access his blood pressure using home-based monitoring. Which of the following statement regarding HBPM is correct? Here the cutoff for hypertension using HBPM more than 140 by mmHg, no. HBPM should be performed by 3 days averaging both the morning and evening reading, no. The first day value of HBPM should be discarded for the accurate assessment, yes, the right answer. Potential because the first day value of HBPM should be discarded for accurate assessment. Potassium measurement bias, home based BP monitoring is recommended for tracking blood pressure, and outside for clinical setting also. Hypertension is defined as BP constantly exceed 135 by 85 mmHg at home. HBPM involves measuring BP twice daily in the morning and evening for 7 days. Measuring BP twice daily, morning and evening for 7 days. And the first day value is discarded and the average of the remaining 6 days is calculated. Proper cutoff is crucial, typically 80% of arm circumference with width exceeding 40% and arm length. And before measuring BP, individuals should rest for 5 minutes and wait 30 minutes after smoking or consuming coffee. BP should be measured in both arms and legs to detect any discrepancies or any sub disorders. Next question. A 45-year-old male present to the clinic for a routine checkup. His blood pressure reading is 136 by 88 mmHg. He has a family history of hypertension, but his past medical history is unremarkable. He denies any symptoms. What is the most appropriate classification of his blood pressure according to the AHA guidelines, and what should be the next step in management? Stage first, hypertension lifestyle modification. Correct option. The AHA guideline classify hypertension as follow: normal 120 by 80 mm Hg and elevated 120 to 129 less than 80 mm Hg. And stage first, STN 130, 139, 80 to 89 mm Hg. Stage 2, STN more than equal to 140, 90 mmHg. Here the given the patient blood pressure reading of 136 by 88 mmHg. He falls in the stage first hypertension category according to the AHA guidelines. And what is the initial step? The initial management approach for stage for hypertension involves lifestyle modification, including dietary change, weight loss, regular exercise, reduced alcohol consumption, and sodium restriction. The pharmacological therapy is not typically initiated unless there are compelling indicators that the patient has additionally cardiovascular risk factor. Next question. A 55-year-old male present to the emergency department. He was diagnosed with hypertension 7 months ago and his condition has been deteriorating since then, even on regular medication. On examination, his blood pressure is 200 by 120 mmHg. Fundoscopic examination reveals retinal hemorrhage. A CT scan of the brain shows a hemorrhage in the putamen. Laboratory investigations show evidence of microangiopathic hemolytic anemia. What is the most likely diagnosis for the patient condition? Here the essential hypertension, malignant hypertension, hypertensive urgency, and hypertensive emergency. Here the correct option is option B, malignant hypertension. In the malignant hypertension is characterized by severely elevated blood pressure along with the end organ damage. The presence of retinal hemorrhage, intracranial hemorrhage, putamen, and microangiopathies, hemolytic anemia are all consistent with malignant hypertension. These are all the features of the malignant hypertension. And what is the essential hypertension? Essential hypertension is incorrect because essential hypertension typically does not present with acute end organ damage such as intracranial hemorrhage, microangiopathic hemolytic anemia, and renal impairment. And the hypertensive urgency refer to the severely elevated blood pressure without acute end organ damage. This patient has evidence to end organ damage, making hypertensive urgency less likely. But in the hypertensive emergency is characterized by severely elevated blood pressure with acute end organ damage. However, the term malignant hypertension especially refer to the hypertensive emergency with a characteristic feature described in the patient. Here the patient presentation or the patient complaints. And what is the malignant hypertension? Fibrinoid necrosis occurs in the vessels supplying various organs, various parts of the body, and mortality rate increased by 50% in 6 to 12 months. Retina hemorrhage, brain, putamen, intraparenchymal bleed in kidney, nephrosclerosis, and in blood vessel, microangiopathic hemolytic anemia. Thank you and keep revising.